Imagine this for a moment. The lights feel too bright. Every sound feels too loud. And inside your head, there's a deep, throbbing pain that refuses to be ignored. You try to push through your day, but your body is clearly asking you to stop. That is not just a headache. That could be a migraine. Today's video is part 1 of our migraine series. And in this first part, we are going to gently and clearly understand the symptoms of migraine, the different stages it moves through, the possible causes, and who is at risk of developing migraines. No complicated medical words, just clear, simple understanding of what your body may be going through. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. What is a migraine? Now, let's start from the beginning. A migraine is a type of headache, but it is much more than pain. It usually causes a strong throbbing or pulsing sensation, most often on one side of the head. For many people, this pain comes along with nausea, vomiting, and extreme sensitivity to light, sound, and even smells. A migraine attack can last for a few hours, or sometimes for several days. And during that time, daily activities, work, family, screen use, even simple conversation can feel almost impossible. Warning signs and aura. For some people, migraines don't arrive suddenly. They give warnings. This brings us to something called an aura. An aura is a set of warning symptoms that can appear before a migraine starts, or sometimes during it. These symptoms come from temporary changes in the nervous system. Someone might see flashing lights, bright zigzag patterns, or dark blind spots. Others may feel tingling or pins and needles on one side of the face, arm, or leg. Some people even struggle to find words or speak clearly for a short time. These symptoms can be frightening, especially the first time, but they are usually temporary and reversible. The 4 stages of a migraine. Now let's understand how a migraine attack often unfolds. Migraines typically move through 4 stages, although not everyone experiences all of them. Prodrome stage. The first stage is called the prodrome, 1 or 2 days before the headache itself. During this phase, your body quietly sends signals that a migraine may be coming. You may notice mood changes, feeling unusually low or unusually energetic. You might crave certain foods, yawn more than usual, feel neck stiffness, retain fluid, or need to urinate more frequently. Many people don't realize these are migraine warnings until they start noticing a pattern. Aura stage. Next comes the aura stage, which we just discussed. Again, not everyone experiences this, but for those who do, it can last from a few minutes up to an hour. Attack stage. After that comes the attack stage, the migraine itself. This is when the head pain is at its worst. The pain often throbs or pulses and is usually on one side, though it can affect both sides. Light feels unbearable. Sounds feel sharp. Smells feel overwhelming. Nausea and vomiting are common. Even gentle movement can make the pain worse. If untreated, this stage can last anywhere from 4 hours to 72 hours. Postdrome stage. Finally comes the postdrome stage. This is sometimes called the migraine hangover. The pain may be gone, but you may feel drained, confused, foggy, or extremely tired for up to a day. Some people feel unusually emotional or even strangely elated. Sudden movements can briefly bring the pain back. Causes of migraine. Now let's talk about what causes migraines. The exact cause is not fully understood, but we know that genetics and environmental factors both play a role. Migraines involve changes in the brain and in how certain nerves communicate, especially a major pain pathway called the trigeminal nerve. Chemical messengers in the brain also matter. One important chemical is serotonin, which helps regulate pain. Another is CGRP, a substance closely linked to migraine pain and inflammation. Common migraine triggers. Migraines are often triggered by specific factors. Hormonal changes are a big one, especially changes in estrogen. That's why many women notice migraines around their menstrual cycle, during pregnancy, or around menopause. Stress, whether emotional or physical, is another major trigger. So are bright or flashing lights, loud sounds, strong smells, and sudden weather changes. Sleep matters too. Too little sleep or even too much sleep can trigger a migraine. Certain foods, alcohol, especially wine, excess caffeine, skipping meals, and some food additives can also play a role. Who is at risk of migraine? Now, who is more at risk of migraines? If migraines run in your family, your risk is higher. Migraines can begin at any age, but often start during the teenage years and peak in the 30s. Women are about 3 times more likely than men to experience migraines. Largely due to hormonal influences. Hormonal transitions, like puberty, pregnancy, and menopause, can change how migraines behave over time. When to seek medical help. Before we end, an important reminder. If you experience a sudden severe thunderclap headache, a headache with fever, stiff neck, confusion, seizures, weakness, or vision changes, a headache after a head injury, or a new headache after age 50, please seek medical care immediately. These could signal something more serious. Key takeaway. So let's pause and reflect. Migraines are not weakness. They are not imagined. They are a real neurological condition, and understanding them is the first step toward better control and better care. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. And in part 2 of this series, we will understand the different types of migraine, explained in very simple, easy language, so you can recognize what type you or your loved one may be experiencing. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.